Hi, I'm Betsy Nicoletti. Thanks for joining me for one of my quick videos, one of my Can I Get Paid videos. And today's topic, can I get paid if the office nurse in a medical practice makes a phone call to a patient? So let's start with what services can you get paid for when done by a clinical staff member in a medical practice? Well, for services that are identified by a CPT code and within the scope of practice of the clinical staff member, with supervision as required. For example, venipuncture, injections, nebulizer treatments, insertion of a bladder catheter, cast application and removal. Those are a few examples from around the CPT book where you can get paid for services done by a clinical staff member. There are also some management services that include the work of a clinical staff member in your practice, and that work at times may be a phone call. Of course, we're not doing it for administrative tasks because the codes that I'm talking about are care management codes and remote monitoring codes. But you have to check these definitions very carefully. And just as an example, there are both chronic care and principal care management codes and remote monitoring codes that include the work of only a physician, nurse practitioner, or physician assistant, and some that include the work of clinical staff. And TCM can be either or. So you've got to check those definitions carefully to make sure if you are including work that your clinical staff member has done, and that includes phone work, that it meets the definitions in those codes. Now, I'm not talking in this brief video about telephone calls during the public health emergency between physicians and non-physician practitioners and patients. Even though I'm recording it during the public health emergency, that's not the topic of today's quick video. Talking so much, it's not going to be quick. But there are codes for phone calls between a clinician, physician, nurse practitioner, physician's assistant, or some other type of professional and a patient. And here we've got our phone call codes, 99441 to 99443. Before the public health emergency, these had a bundled status, and Medicare intends to return them to a bundled status after the public health emergency, unfortunately. And in that section, if I look at the phone call codes, CPT says, for telephone services provided by qualified non-physicians who may not report E&M services, that is, speech language pathologists, PT, OT, social workers, dietitians, see 98966 to 98968. So these codes in the back of the CPT book in the medicine section are for clinicians who are able to enroll in Medicare, have their own, and be paid directly or through their practice for their services and other insurances. So these codes are 98966 to 98968. And again, we expect that these codes will return to having a bundled status after the public health emergency ends. So phone calls by nursing staff or other clinical staff. There are no CPT codes that describe these services. There's no separate reimbursement for your care manager or the registered nurse in your office calling and talking to a patient. There are some care management and remote monitoring codes that have services described in the code that include the work done by medical practice nursing staff, and that could be telephone calls. So the answer to this question feels like finding the needle in a haystack. We've ranged all over the CPT book, but the answer is, can you get paid for a phone call from your nurse or care manager? No, not unless that work is part of a care management or remote monitoring code and is done, under the supervision of a physician, nurse practitioner, or physician's assistant. So thank you very much for joining me today. There are more. The next one coming up, can I get paid for taking stitches out that were done in the emergency department?